Okay. Hi, Stephen. How you doing? Hi, Kathy. Hi, Steve. How you doing? I'm fine. How are you? I'm great. Y'all just hang with me just 1 second. Trying to get a little organized here. Okay, we got a lot of semi-moving parts, so I normally don't have a whole lot of notes, but it's gotten to a point in time where we got so many important things to cover that we surely do need the notes. We don't want to miss anything. First of all, I appreciate you coming. I appreciate everybody last night, and I appreciate really more than anything your patience, because it's inconveniencing you in some ways, and there's a lot of moving parts, and it's just difficult. Again, I thank our President, Mitch Carmichael's back there in the back, and some others that I appreciate them being here. I want to reiterate what I said last night. It's a time to be really concerned, and it's serious stuff. But it's not a time to panic. It's a time to be cautious. It's not a time to be fearful. It's absolutely a time to be really smart. And it's not a time to be weak. It's a time for us to rise up and be what we are. And that is West Virginia Mountaineer strong. Absolutely strong in every way. So with that, I also said last night, and I mean this from the bottom of my heart, and you'll probably get tired of hearing me say this, but while the days and the nights can get really lonely and the decisions be huge to make, I don't run from big things, and I don't run from challenges. And I'm honored to be at the helm, and I'm not going to let you down. And so with that being said, I've since we met the last time, I've talked to the Trump people. I've not talked directly to our president. I am putting in a call for our president, and it may very well be that as soon as I get through talking, I'm going to have to go, because I really believe that his comments yesterday were really nice, and he's got a lot of confidence in me and everything else, but at the same time, I want for sure that the president to know directly from me that we are a high-risk state, and we don't want to drop our guard in any way. And so it's really important for me to talk directly with the president and try to impress upon him to continue in every way, shape, form, and fashion. And I know he will. I know he will. He's not going to let West Virginia down, because he's not going to let Big Jim down, and so at the end of the day, we just need to keep that dialogue going. I've got all the confidence in the world in what our president's doing. Now, I've got to say this, and I want everybody to understand. I want everybody to just be right with me and understand. To be doing all that is happening from the federal government side, you've got to be able to read the tea leaves and know that this is not just something that's not really serious. And from that, I've given you the pathway. The pathway is really simple. The pathway to success here is the fact that we absolutely don't congregate in crowds. We absolutely try to work at home as much as we possibly can. And we accept this challenge, not regretfully. We say we've got a real issue here. We do. We have a real issue. And with that real issue or real challenge in front of us, we're going to basically volunteer in lots of ways to be able to attack this terrible issue. And that meaning we've got to stay home. We've got to work from home. We've got to not panic. We've got to stay apart from one another. That in itself is our power to combat this terrible situation. That's what we got to do. And all West Virginians now have got to really join me. Now, I'm going to get into a lot of other stuff and everything, but I'm going to just kind of just go through it pretty quickly. You know, I want to salute all the congressional help that is going on. Whether it be, you know, our congressmen and women, or it be our senators, everybody's helping. And I really appreciate all that they're doing. And so, you know, all I can say is thank you and continue to do the good work, because we all need everybody pitching in. There's rumors that are going around everywhere from we're going to declare martial law and all this kind of stuff. I mean, come on, please, let's stop the silly rumors, you know. And now, one thing that we're doing that I mentioned day before yesterday, and it's this right here, and Bill Crouch can maybe elaborate on that a little bit more, is but we already put in motion, you know, the fact that we're looking at hospitals that have closed, and I'm going to do it today, you know. Now, if I can get to our president today, or vice president, or whomever I can get to today, you know, I'm going to today, you know, impress upon them the fact that if we can get the equipment, you know, basically for a potential catastrophe situation, and we can move that equipment into a facility that, you know, our Secretary Crouch is going to work on, and we can have that equipment ready on standby in case we would have an overload in our hospitals that we have and have to go to a place, you know, with that has a considerable amount of beds that are available. You know, we need to look at that. I don't know that we'll be able to get that all done, but it's something we surely are going to try to look at. The other thing is, everyone should know that our grocery stores, our drug stores, all the things that we have to have from the standpoint of being able to get gas or whatever it may be, they're going to be open. We don't need to absolutely panic, and we don't need to go panic buy. We absolutely just need to stay calm and be smart, and we're going to get through this. And we're going to get through this in a good way. Now, in the last 24 hours, there's been a lot of things that's changed, and this thing is a moving target like crazy, and we got to absolutely just stay with it and knowing that things are going to change. In the last 24 hours, we've asked for 2 weeks that we close all the restaurants, all the bars, all the casinos. Well, today we're broadening that a little bit, and today we're going to ask for 2 weeks that all the gyms, health clubs, and recreational facilities close. And again, I am asking our businesses, you know, and our chamber leader, Steve Roberts, is here with us, and he can expound on this some in just a few minutes, but I'm asking our businesses to do exactly what they've been doing. Help. Help in every way. Let your employees work from home. Try in every way you possibly can to let people go home. I mean, home is the key to everything here. We've got to keep the essential part of our existence going, but we got to go home. That's all there is to it. And if we go home and we work from home and we go out and walk the dog, or we go to a state park and walk around and everything, great. But we've got to get away from each other. Now, with that being said, I want to move to just the simple things like hygiene. I've said it over and over and over. Please wash your hands. Please take care of the elderly. Please go to the grocery store for whomever it may be and try to help the elderly out. If the grocery stores are really full, don't go there, and just delay it for a couple of hours. Pam, my executive assistant, she said she was in a grocery store and there were several elderly men there that were having trouble walking and having trouble getting their stuff and everything. I mean, we don't need to have that today. We as West Virginians have got to step up in every way, and I urge you beyond belief to have confidence that we got this, and we're going to stay on top of it, but we got to have you helping one another. Now, from a personnel policy of all the people that are working here, I want to go through that just a little bit. And we've revised and revised and revised, but the net of the whole thing is this: we have got to entrust all of our secretaries of all of our cabinet and everything to do the right things in every way and stay on top of all that. Now, and from all that, what we've got to do is just this: you've got to tell her to quit talking, because I can't hardly hear myself and everything, But from staying on top of all that, what we're instructing our secretaries to do is let everybody work from home and some way, somehow, keep the essential services going. Now, everybody doesn't mean everybody in this situation. We're expecting our secretaries to call in those people that they need to keep the essential services moving in every way. But anybody that can do their task at home, I'm telling them to absolutely let those people do their work at home. Now, let me just say this. We really need to step back and brag on our people a little bit, because they're doing great work and they're tired and they're going to get more tired. We've got all kinds of people that are out there doing great, great, great things. Whether it be our cooks, or it be the people that are driving our buses, that are delivering food to all of our kids in need, to whether it be all those that are working right here, right now, in every way, shape, form, or fashion, to be able to do the things to keep our government running. Whether it be all of our highway workers or whatever it may be, absolutely we should be proud of our people. They're doing a heck of a job. So, we've got our chamber people here. Again, I want to brag just a second again on our businesses, because our businesses are doing exactly what we need to have done. Now listen, I said this last night, and I want everybody to listen to me and listen really, really closely. Every day that goes by, we get better. Absolutely, without any doubt whatsoever, if we continue to listen to what I am telling you, we'll be better and better and better. If we don't, people will die because of our lack of absolute volunteerism in trying to keep us apart and use our power. Our power, if we don't use it, will cost people lives. And that's all there is to it. And we won't be able to bring them back. We'll lose them. And if we don't use our power and use our power wisely, and our power, one more time, is the fact, our ability to be separated. Right now, we've got to use that. And our businesses are helping. And I salute them in every way. Now, it's tough stuff. It's tough stuff when you have to go home and our businesses are worried about, well, how are they going to survive? And our people that are going home are figuring out, how in the world am I going to buy the groceries, or how in the world am I going to pay the power bill? And I'm telling you, our nation and our state and us as people are going to step up, and everybody's going to be taken care of. But in the meantime, we have got to use our power, because if we don't, we're going to end up with more and more and more people that die. And if that be the case, we can't replace that. The very last thing I'll tell you is just this. And then I'm going to leave you with these individuals that are going to answer your questions. And that's just this. From a money standpoint in the state, I just got an update, and here's the deal. If lottery shuts down for 2 weeks, it's going to cost us $18.4 million. That's the lottery fund and the excess lottery fund. That's not the general revenue fund. From the standpoint of where we are in the state in the month of March, we're good to go. We're still good. From the last thing, and this is the very last thing, and that is just this. From the unemployment claims that we have, from people filing for unemployment, just think about this. We had 1,200 yesterday. We had 5,300 in the month of February. So from that standpoint, you can just see that if we stayed on that pace, we'd have 25 or 30,000 versus 5,300. And it's going to get worse. It's going to get worse. This is a very, very, very serious moment that we have never, there's not an individual here or anywhere in this state that has ever faced this type of moment. It's serious. We can beat it, and we will beat it, but we've all got to recognize what we got to do. I'm going to leave you with everybody here. I'm going to go try in every way, shape, form, and fashion to be talking to the president. Thank y'all.
Ladies and gentlemen, our panel members will be happy to take your questions, but they've each prepared remarks that they would like to make first, so we're going to let them speak first, and then we will field as many questions as we can. So we're going to start off today with Dr. Clay Marsh with the West Virginia University. He is the Vice President and Executive Dean for Health Sciences. Dr. Marsh. Apologies, everybody. Bear with us as we work out the audio. All right, we'll start off with Mr. Steve Roberts, President, West Virginia Chamber of Commerce.
I'll go ahead, and then if we get volume or want to hunt to Dr. Marsh, just give me this. As the companies that I think all of us would recognize as our most sophisticated employers are taking this the most seriously. They are encouraging some are requiring their employees to work from home. Most are encouraging their employees to work from home. Many that I am familiar with are finding ways to grant extended leave for those who may feel they need it. In our own case at the West Virginia Chamber of Commerce, we are a healthy organization. We believe that small businesses in particular will be really set back by all of the events that are occurring. We sent a note to the local chambers of commerce yesterday saying that we wanted to be available to help them, and that anything that they were thinking of purchasing from us would be free to them for the remainder of the year, because we think that particularly in our smaller towns and communities in West Virginia and among our smaller businesses, that the pain is going to be great, and it may be protracted, and we hope it's not, but better to be prepared than not prepared. I'd also like to be able to point out that it's been my experience that the supply chain is up and operating and working well. Stores that had previously been running out of certain goods are being able to restock their shelves with those goods. I've had several reports today from stores that were able to get shipments in and are restocked. So the reports that the supply chain is working appear to be accurate, and I'm pleased to be able to report that. The U.S. Small Business Administration is rushing a low or no interest loan package to the fore, so that businesses that find themselves in a period of great stress and need to get a quick loan that they can afford will be available. Those are not quite available yet, but they are being rushed to the front so that they will be available. The governor made mention of the unemployment compensation situation in West Virginia. I monitor our state's unemployment compensation fund on a regular basis. Proud to say that because of changes that were made in the way we handle unemployment compensation in West Virginia, approximately 10 years ago, we have a solvent fund. And while we can't be sure about how many people are going to need it, we want it to be there. We want it to be functional and operational. And employers are committed to doing whatever is necessary to see that those who have lost their job are able to get those benefits and have a sure benefit stream so that they can make their house payment, their car payment, their rent payment, buy their groceries, pay their medical bills, do all of those things that are so important to life as we know it here in the great United States. One of my favorite preachers preached a sermon one time that the thesis of which was leadership requires followership. This would be a very, very good time for us to follow our leaders' advice. We are absolutely convinced that we have gotten ahead of the coronavirus in West Virginia, that we are seeing particularly the employers that I'm familiar with doing the right things. They are sending their people home. They are encouraging their people to work from home. They are doing everything possible to see that people can work remotely. Of course, not everyone has the kind of job that will allow her or him to work remotely, but those who can are being encouraged to do it. And I am optimistic at this point that we are getting ahead of what has been a real health crisis in other parts of the country. So the safety net for people who may have lost their job is very important. The employer community is committed to helping us have a solvent and well-functioning safety net because I know you want to hear from other people, and you might have gotten Dr. Marsh back. I will wind up by thanking Dr. Marsh, Secretary Crouch, Dr. Slimp, and General Hoyer. Thank you for the extraordinary work you are doing. We are all in this together. There are no divisions. There is no east or west or north or south. We are all in this together, and we remain very, very committed to doing the things that will see our state and our nation through this very perilous time. Thank you.
And I believe with that, we have Dr. Marsh back with his audio good to go. So, Doctor, whenever you're ready.
Thank you so much. Can you guys hear me?
Yes.
Great. So it's really a pleasure to be part of this great team
And I want to use just a few minutes to give perhaps a little bit of background and context to the governor's comments. So we know that this viral infection, this pandemic, the first time since 1918 that we've had a pandemic, is really problematic because the virus appears to infect people at a time before they have symptoms, and it becomes very, very high in concentration in this pre-symptomatic period. So people who, bite their fingernails or eat food or have their hands around their nose or their eyes can put their hands on, tabletops and elevator buttons and other places, and potentially to put the droplets with the virus in it that could then be picked up by other people. We also know that people that coughing, sneezing can spread this virus. So because people are oftentimes not symptomatic, at least the way that they look and feel at the time that they can exchange the virus, it makes it very hard for us to be able to limit the virus spread from each person. And because of that, we have to believe and approach this virus like it is everywhere. And even though we just had our first positive case in West Virginia, we know because of the pandemic nature of the virus, which means it's everywhere, all over the world, that instead of relying on just wiping down surfaces with Clorox or with Lysol, we really need to be smart about using the power that we all have. And the virus really relies on both our connectivity to each other to spread person to person, but also relies on the fact that sometimes we'll get things on our hands and introduce it to our mouth or our face in a way the virus can spread. And we know that this started in December 2019, and now it has spread all over the world. And what we've learned from other places that the virus has spread is that the most dangerous problem with the virus is not only the infecting sort of symptoms and the clinical problem that people who get the virus can have. And this is particularly problematic in people that are older and that are overweight and that are sicker. And there's a study done in the United States, and West Virginia has the most vulnerable population to the potential bad outcomes from this virus. But the even bigger problem that we see in Italy and that we saw in China is the fact that if this virus spreads really rapidly, we can end up with a tsunami kind of effect. And that big wave of people that are sick and ill and coming to the hospital and the emergency room starts to overwhelm our healthcare capabilities and the healthcare workers. And after a while, they become overwhelmed by the amount of sick people and the complexity of illness, critical care illness, people needing ventilators. And we know in countries where you can take that tsunami wave and make it a river or a stream where you just get a steady flow of people come into the hospital, but where hospital operations can go on normally, that the death rate, when you can keep it under control, is less than 1%. And the death rate around the world, if you get overwhelmed, if the tsunami waves hit your hospital people and your hospital capabilities, is 3 to 5% around the world. And in Italy, that's been particularly hard hit, and Italy is a country that we're tracking right now, the death rate is 6.6%. In parts of Italy, they're deciding in their hospitals that they can't treat certain people because they just don't have the resources. And so people over 70 years old in Italy don't even have the chance to get the advanced life support that we give people routinely here. So as we look at the risk to our population, it's not only the introduction of the virus to West Virginia, it is the rate of spread. And what the governor said is so important because we have some real power. Now, many people would say, wow, distancing ourselves and socially isolating ourselves for just a little bit of time, washing our hands and not touching our face, those are not big powers. But this virus thrives on the connectivity. We need to break connectivity. There is evidence that's published that says that if we, in a voluntary way, If 75% of people in our state
and our communities can isolate
themselves, can separate themselves, can stay mostly in their houses, but if you go out where, stay 6 feet away from the people around you. If we can do that 75%, we can make the tsunami wave a river, and we'll survive it and we'll be able to deal with it, but it will be taxing on our health people, and some people in our communities will get sick. If we can get even better, if 90% of our people voluntarily put themselves in kind of with their family in their home, or home mostly, and from other people, that cuts off the life source of this virus. And in that setting, we believe we can make that tsunami wave a stream. And we can get through this better maybe than anybody else, because the natural firewalls that we have in our state, small communities, a lot of people don't move out of the state that much or internationally. We have mountains and rivers. So we are naturally set up to be a place that the virus has a harder time negotiating, because the virus thrives on close contact, lots of people together. And this is our opportunity. We're the last state in the country to have a positive case, and we know the virus is in West Virginia, but by working together and demonstrating what's made this state so great for so long, the people, the communities, this West Virginia strong together, we can beat the virus and we can be the best place in the country. And I'm a realist, and I've been out there and I've been very concerned, and I still am. This virus is going to devastate many parts of our country. I think New York City is really in trouble. They're sending a military support boat, a medic boat to New York. Because once this thing is started, we know by the time you see the tsunami wave, that has been going on in the community for over 2 weeks. So that's going to continue for places that start getting overwhelmed. But it is our opportunity to be the place that controls the virus, that helps each other. Because if this virus spreads in West Virginia and our healthcare workers and places get overwhelmed, we're going to have desperate problems, because our population is older and has medical problems by their nature, by what we have seen happen in the state for many years. And because of that, then we will lose a lot of lives if we don't do this. So I think that the opportunity to be the leaders here, to work together, to do this voluntarily, to help each other, will allow us to create a great future for this state, and importantly, will allow us to protect the lives of the people in the state that we love. So with that, we are very also committed to working with the governor's office, with Secretary Crouch and Commissioner Slemp, and certainly General Hoyer and Steve Roberts, who I can't thank you enough for stepping up, the business leaders all together. This is such an extraordinary moment in time. And life is changed, like 9/11. This is a black swan event. It's an event that's changed everything. And we need to test in greater numbers so that we can really understand who's infected and who's not, and start to do the kind of public health measures that Commissioner Slemp knows very well. But this is a moment in time that if we work together and if we do the right things, and also washing your hands is important, because the virus can be sitting on a table when people aren't symptomatic, or an elevator button or whatever. And we ask people, before you put your hands to your face, before you eat something, wash your hands 20 seconds between your fingers, around your wrists, with soap and water. Happy birthday twice, ABCs, sing country roads. And then don't put your hands around your face, because that's the way you introduce the virus to yourself. So I am very, very grateful to be part of this great team. Very grateful for the leadership of the governor and the cabinet and the leaders you see in front of you. And that really concludes the comments I have to make.
All right, we thank Dr. Marsh for his comments. Next, we're going to move on to a gentleman who you all know quite well. We're going to go to Major General James Hoyer with the West Virginia National Guard.
Okay, folks, just a couple of updates. One from Dr. Birch and the folks at the Department of Education and the county board partners. The feeding system for our children continues to go exceptionally well. And now in day 3, they're starting to make some modifications, and they'll make those over the next several days. He asked that I encourage folks to go out to the Department of Education site and look and see how that works.
Guard will be available to support the counties where necessary. So stability for our children continues to be in place and go well. As many of you guys know, probably one of the most significant partners we've got in the state of West Virginia related to emergency response is West Virginia VOAD, Volunteer Organizations Active in Disasters. They have initiated their committee system that they have to work on a variety of issues, to include emotional and spiritual care support, but also the things in planning that we do to help out in communities. They're looking at their demographics and determining folks within their ranks that may be more vulnerable, that can't be available, and we've got a Guard liaison in with VOAD working to identify where they may have shortcomings or gaps. We'll help fill the void on those things. The Mountaineer Food Bank, part of the VOAD system, is also working with other partners within the food bank system, and they're going to look at if the potential of standing up mobile food pantry setups. So if we have to move within communities to minimize for those who are most vulnerable and in need and keep them where they need to be, they'll be working those activities as well. They have regular contact with the State Emergency Operations Center as well as with DHHR Public Health and Threat Preparedness. The other most important thing, if you can help get this word out, for non-medical and non-emergency needs that folks out there who are vulnerable population may need assistance, VOAD has activated what we call West Virginia 211, which is the system we use during state emergencies for somebody to call and say, hey, I'm having this challenge, I need some assistance, how can you help me out? And VOAD will then coordinate resources across the spectrum to help people out. So some very important things to put out and for us moving forward, and appreciate your help in getting those things out to the public.
And I believe lastly, we have some joint remarks from our health leadership. We have Dr. Kathy Slemp and Secretary Bill Crouch.
Yes, thank you all. I'll give you a little update on where we are in terms of our communication with the federal government, and let you know that we have great communication there. I know the governor's been making calls. I have to thank our two senators, Senator Manchin, Senator Capito, have called multiple times a day. I've spoke to both of them before 10 a.m. this morning. They called me to again ask what they could do. Actually, last night I got a call from Senator Manchin leaving the press conference, who said he was speaking with the Vice President within 10 minutes or so and needed to know, again, some of the items we needed in West Virginia. I then got a call at home last night from a assistant secretary for HHS who asked me what we needed. We provided a detailed list, and got a call from his assistant this morning, and who held on the phone while we got an address for the DHHR doc to make sure that they could ship some items immediately. So we are looking for more swabs and transport media. There are different departments that are responsible for different things. So we're communication. Had a conference call set up with Dr. Cadlick, who is the assistant secretary, and he was still at the White House, so we had that conference call rescheduled. We're trying to get that rescheduled for today. So there's a lot of communication, a lot of assistance from our senators, from the governor in terms of his contacts, and of course he mentioned he's trying to call the president directly, and we're hoping to get, I'm pushing hard to try to get some of the mobile units that other states are receiving to do drive-through and walk-in testing. We have been somewhat the low priority. If you think about that, that's because in any epidemic of any kind, the priorities go to where the disease is. So it's kind of easy to understand human nature in terms of going after the issues where the problems are. So, but we're changing that priority, and we're moving West Virginia up closer to the top. So I'm confident we're going to get what we need to move services forward and tackle this virus. Kathy, you have anything to add to that, or?
It'll be really short. I think everything folks have said is really right on target. There will be some additional environmental health guidance for restaurants and bars coming out on the website this afternoon. And I just want to do a shout out to staff and employees who have been doing phenomenal, really hard work, and they have spent long hours and done an incredible job with that. It is challenging and difficult. I also want to say, this is an unprecedented situation. This is the kind of thing that you do exercises for in times past. And what's exciting about this one now is how much all those levels of leadership have been actively engaged and really working together with this. So there's been incredible understanding and support across the secretaries across the Trump administration here, across the department here at the governor's cabinet level. The federal response has been super, as you just heard from Secretary Crouch. People are at the private sector getting on board. This really is about aligning efforts. And it always takes a little time at the beginning of these things, but it's exciting to see it happening. So thank you.
I do want to just echo what Kathy said, especially General Hoyer, other departments of government. A very good working relationship with everyone here. It is if there's a positive to come out of this, it's that we've shown we can work together extremely well, and we are with the business community as well. We're doing some things that are unprecedented, and we could not do that if we didn't have the cooperation that we have with everyone. So thank you. And the press, let me add the press in terms of, again, the information that goes out in the papers, on social media is important. It is important to pass this message along to our citizens.
Secretary Crouch, there's a letter circulating today from the West Virginia State Preparedness Director about the lack of supplies that West Virginia did receive, and we requested so much and received in some cases 98% less than was initially requested, and then in another case, 0 of the surgical masks that were requested were provided. Do you feel like the help from the federal government, while it's been good in the last 24 hours, this letter was dated yesterday, do you feel like West Virginia has not received the attention it deserves?
As I mentioned earlier, we started this communication, really communicating with Washington earlier in the week. I did not see that letter until it went out. I think what that's showing is actually dedication and some frustration on the part of folks who really want to serve West Virginians and want to keep West Virginians healthy. So again, if you have an epidemic, it's very, very common and necessary for supplies to go to the area where there are outbreaks of that epidemic. We have a situation in West Virginia where we are extraordinarily lucky with our situation right now in terms of our ruralness, small cities. We have no cities larger than 50,000 people. We have very little international travel relative to other states. So we've not been given priority, but I understand that. Now that we're yelling a little bit louder in terms of, hey, we are higher risk in terms of not only our elderly population, but folks under 65 years old who have underlying conditions and have heart disease or have diabetes. So I think we will be given a little more priority in the future here.
The Martinsburg Journal reported earlier today, I think WCHS even talked about it too, but they had talked to Carolyn Vigil, who is the wife of James Vigil, who I understand is first came back, showed a negative, and then they showed a positive later. Can you all speak to that and the issues with that particular case?
Yeah. Let me focus on a couple of things here. First, the key things to know about this situation are that in terms of the actual case, is that the exposure itself was out of state. And so that's where the exposure was. The healthcare system was phenomenal in how they triaged the patient and really did all the right things. individual themselves was super about doing the right thing about staying home. They really were phenomenal with that. You know, I don't want to go into I don't want to go into specifics of any individual case. You know, one of the things I think that's really important with these kinds of things is that we really, as we move forward, we really respect the confidentiality of the patient and their family. And so I really think that we can do that collectively together. What I can tell you about is what happens when we identify a case. And so this is a standard case investigation that we do public health investigations of infectious diseases every day. So last night, they actually began that investigation. What an investigation looks like in general is you contact the patient, you interview the patient, you understand the activities they've been doing and the potential exposures. You contact anyone that you think might be have been exposed or have a contact. You are cautious with that, and then you talk to the folks that may have been in contact and decide what you do with those. So that is what is actively underway. They're working hard at it, and it's moving forward. So we appreciate that.
I don't know if anybody can answer this question that's on the panel, but has there been any coordination with utilities in West Virginia, American Electric Power, Western American Water, and Mountaineer and Columbia Gas to protect or separate, or, lack of a better word, quarantine their workers in the event of something unthinkable would happen, and we would need those people to address the utility situation?
And the Guard has a list of organizations, just like we did during the derecho, that we're reaching out to get regular updates. AEP, Mon Power, and those are ones. So we're assessing that right now and working through that, as well as working through with the Retailers Association and others on the practices they're using to protect their employees and address that. I don't have anything specific other than right now we're okay, but there is a system that we're doing on behalf of the governor for a common operating picture to assess those situations, just like we did during the derecho, just like we did during Hurricane Sandy, just like we did during the water contamination.
You have to have some type of event that you need those people, or some type of sickness would have to break out?
Well, I think right now what we're trying to work out is something we've never done before, dealt with. So we're looking at what are they doing. So, for example, and Steve and others working with Manufacturers Association, our plants that have to stay open to keep chemical processes going are monitoring employees as they come into the plants to address health surveillance things like Dr. Marsh has talked about. So we know we have to have people do essential services. I can't shut down the National Guard, so we're putting in systems in place so when you come through the gate, you're going to get a monitoring set of questions. If you exhibit a symptom or something like that, we'll isolate and do the appropriate things that we have to do, just like when I've got air crews coming back from overseas. I can't not just leave them overseas. They've got to come back. We've got to put them in the appropriate process that the medical folks tell us makes sense. So all those things are in progress right now. But yes, somebody is reaching out to all those organizations, and we're looking forward at potential challenges that we may have. But you hit on a good and important point. We've got to be preparing for those things going forward.
This question is for DHHR. In a press call earlier today, Senator Capito had mentioned that you all had requested an emergency shipment of medical supplies, and then I heard you talking earlier about requesting more swabs and transport media. I was wondering if you can address, first of all, what transport media means. Secondly, how many swabs do we currently have, and is it at an emergency situation right now where we're very low, and if you requested any other types of supplies?
I certainly didn't use the word emergency with Senator Capito, so I'm not sure where that, we have swabs. Kathy would know the number of those. The transport media is what you transport the specimen in to get that to be tested. Yeah.
You know, I think we've talked about wanting to expand testing, and you all have asked about that. And so I think we're looking at lots of ways that happens. And so we were excited to see commercial laboratories expanding. We have been surveying hospitals and asking if they are accessing commercial laboratories, and a fair number are. So with that, we've got a couple of hospitals that are initiating their own testing, which is great. And then we are working, we are testing anything that comes into the lab. As currently, we're caught up with that. And then we are asking for additional supplies so we can really move forward in additional ways to make that more effectively. And then also the Secretary asked about the ability to have some of the more community-based testing discussions that the Governor has nicely, and the Secretary has nicely discussed. So.
Other things in the request, though, other than the transport media and swabs, like ventilators or masks or anything like that?
Yes, you're talking about personal protective equipment, PPE? Okay. Sorry, there's acronyms and
Ventilators wouldn't be considered PPE.
We keep an inventory of that, and then we have a stockpile that we have to spread out to folks that as needed. At this point, we don't need a lot of those. If we're really trying to look ahead, plan ahead, the governor mentioned some options in terms of other hospitals or what we plan to do if we need to do that. Hopefully there's no need to have a separate hospital or a wing for patients that have been exposed and tested positive for COVID-19. But we're trying to look ahead in terms of those plans to make sure we can do that. That's when we'll need more of that PPE, but that's part of the request to the fee. So I haven't been able to connect with them. Again, we have a conference call that had to be canceled because the Assistant Secretary was at the White House, so we had to postpone that from 11 o'clock. We're trying to find out more in terms of how we go about doing that through the individuals who are responsible for those products. So it's a little bit different for each of the products.
So is the emergency shipment that's on the way, that's the swabs and the transport media? Okay, and then there's additional plans to ask for more PPE. Am I getting that right?
Correct.
The President invoking the Defense Production Act expected to be helpful in areas of supplies?
I don't know the answer to that, Kathy.
I think they're invoking everything they can do to really be supportive.
Senator Manchin sent out a news release talking about keeping Fairmont Regional open during the coronavirus outbreak. I wonder what the latest is on that, if you guys have had a chance to speak with his office, and if there are any updates on that.
I really don't have an update on that. Again, the governor's asked me to look at all options, including Fairmont General Hospital, as we move forward. So that is something we're looking at and will begin to look at much more closely here in the next few days.
Can you talk about the stockpile of ventilators that the state currently has? Do you know numbers?
Let me tell you how that works. We actually monitor ventilators around the state and what the use is, those kinds of things. And so states do this around the country. And then if you kind of watch, and if you're getting to a point that you're getting low, then you request from the federal stockpile. And so we know the process for doing that. You can't request until you have more need. And we're not seeing that need at this point. So we know how to do it. They assure us that there are lots of supplies there, and we would reach out to do that through the routine channels.
So it's a federal stockpile, not a state stockpile.
It's a federal stockpile.
Sir,
Can you hold on just a second?
please.
So the governor asked me to come back up and say that he did just go back to the mansion. He called the White House. The White House took his call. They patched him right into the president. He and the president spoke. The president offered all of the support he could from the White House to West Virginia. He said he's on our side. He's here to help. And the governor trusts our health leaders here to get that done. And the governor wanted me to give you guys that update. We will have more information on this in a press release here soon. And that's the Governor Justice there for you. Calling the White House first ring. They picked up and patched him right into the president. So thank you guys.
I apologize if this isn't appropriate for you guys. Prepared a question with the governor of the administration, but with closing healthcare, recreation facilities, health clubs, gyms, restaurants to a degree, and bars, people are facing rent payments, utility payments, et cetera. There is an effort on the federal level to mitigate some of that with money. Is there anything happening on the state level you're aware of, or is that just not your ball of wax?
The governor has said that he hopes to make everyone whole, businesses that are cooperating with us. Maybe more information. He's also talked about the possibility of a special session. So we're trying to see what the federal government is going to do to see what the needs are. Brian Abraham may have more on that. Brian, do you know more?
That's what we said yesterday. We're assessing our needs, and once we determine that, and we look at what resources at the federal level we can marry up with that. Any shortcomings that we have then on a state level, we'll have to look at addressing the assets we have that cover those. So we have our agencies out. You know, we know our unemployment numbers are up, so we're going to have that. You know, Commerce and Workforce will come in and tell us what that need is. So as each of our agencies identify for us what our need is, and we find a federal resource, if there's something lacking, that's when we'll know what the state need is. We'll put a plan together and present that to the legislative leadership with a path forward.
How quickly, I mean, what would you tell people who are literally looking at a rent payment or utility payment today, right now?
If it's due today, obviously we know the Washington money right now is we're going to do. It's not here. The check's not in the mail, so we're going to have to deal with it like, you know, everybody else is.
Recreational facilities. Can you elaborate on what constitutes a recreational facility? Is that a bowling alley? Is that an area's fitness center?
We think it's going to be areas where people are able to congregate and engage in sporting activities. You know, Kenny brought this up yesterday, and the issue is the proximity of the individuals to one another. Not only that, you have the kind of, I won't say transfer of bodily fluids, but the potential transfer of bodily fluids, saliva, sweat, things of that nature. Or stuff that would be left on the equipment. And I realize, you know, the gyms are taking precaution using sanitary measures, but it's just the risk right now is what we're being told from the medical people, that this is the next logical step to take. Yeah, I mean, I could envision, you know, that at some point a bowling alley, if you've got a league going on and the place is packed and everybody's sitting side by side in the seats there as they're waiting their turn, that's what we're trying to discourage. Again, the focus is the social distance. So right now we're trying to rely on the businesses to engage in that themselves. These are the ones that the health people are coming to us and saying these are more at risk. We have to be able to articulate that risk so that we can justify the closure of some of these businesses.
Ladies and gentlemen, Dr.
This is continuing to evolve. We're continuing to evaluate that. We're reaching out to the subject matter experts, our boards that regulate those industries. Those people will come back to us with recommendations. We'll run those through our medical people, and then we may take additional action on that.
Brian's happy to stay and answer any more questions. Dr. Marsh only has time for a few more. Does anybody else have any other questions for Dr. Marsh before he disconnects from the Skype call?
That he addressed that issue, so I wasn't opposed. Dr. Marsh can address.
Dr. Marsh, how are you feeling about the federal response at this point as a doctor, and what is your hope, and do you have any information on Fairmont General, or Regional, I'm sorry?
Well, I know that certainly we're
Very committed to trying to make sure that we provide great health care access to every community in West Virginia. You know, the issues with Fairmont General Hospital have been discussed extensively, as I understand it, with Albert Wright, who is the CEO of West Virginia United Health System, and the governor's office. And I know many, many people have a lot of concern about the sort of the issues with the employees and the access to health care in Fairmont. And all I could say is I know people are working very hard to try to make sure that we provide all of the people who are employed there with, you know, with the opportunity to continue to work as we understand what's the best things to do, both for the community and for the healthcare needs of the region. So I would defer that to the governor's office and to the head of our hospital system that we work with. But I do know that there's been a lot of ongoing discussion about how we can facilitate and try to make sure that we continue the employment and make sure that we have access with the right capabilities to the people of Fairmont and to the region.
By closures to go ahead and place
some equipment, some supplies, some beds. Could anybody clarify maybe a little more what he was thinking?
I can tell you, I think he's got good concepts that he's putting forward in terms of creative ways to use what's available in terms of resources. And I think that is exactly what, and we've heard this from our hospital association, hospitals across regions are planning together and thinking through how they do things individually, how they do things collectively, what are the best ways to coordinate that moving forward. So they're taking that idea very seriously moving forward.
I think the idea, I will remind you again, we had notice of that first case 10 minutes before. Should this progress and it becomes necessary to have a place to place individuals with the virus is where we are now just beginning to look. So we're working hard on getting supplies again. We've had calls and calls, and we've had conference calls that have been postponed, and the governor calls and they put him right through to the president. We're going to use that a little more now. We do have a voice here in the governor who can get things done in Washington, and we're going to take advantage of that. So, but we're progressing, I think, at a good rate in terms of what we need to do. Again, we appreciate Steve and the businesses out there participating in this and being part of this. The public has to be part of this. We have to have folks who understand social distancing, and I'm seeing a lot of that on TV. I've actually seen a couple of people put their hands to their face up here. Some of them might have been reporters. It's hard habits to break, but we need to keep pushing this, and we appreciate your help in getting that message out there to folks.
Folks, I hate to interrupt. Does anybody have any final questions for Dr. Marsh? His time, extremely valuable. We really appreciate him being here with us, so he's got to go. Any final questions?
We want to thank Clay, too, by the way. He's been an integral part of this and just absolutely essential to us moving forward.
All right, thank you, Doctor. If you have to go, be our guest to disconnect, and we'll continue questions.
Thank you.
And real quick before Brian is, are the numbers that are on the website today right now the most updated numbers?
What's it?
22 negative cases, 14 clean.
I don't think we had a run finish yet today, so those are correct. We will post those almost as quickly as we can.
You said people rare, didn't they? I know that.
I know the governor's, like you said, broad authority in certain ways, closing businesses, doing what he's doing. Is there a mechanism in place to suspend rent payments, to halt rent payments? What would stand in the way of that?
Again, be an issue that we're working on, not the virus not spread. That's our overarching concern. So that's why we're regulating these areas where we think the virus can be transmitted. Getting down in the weeds and getting involved in economic matters doesn't necessarily rise to that same emergency level. God, if it spawns out of it, it's just as important. But that's not the power of the governor.
Is that something you'd ask the Attorney General about?
That's something we could have him start looking at, and see if they're willing to take that on. But I mean, that's what we've been doing, is reaching out to them and asking, because again, in this case, his opinion isn't one that matters.
Brian, when Governor Justice made the announcement that he was closing bars and restaurants, he uses the phrase, he used the word mandated, and today he used the word ask to describe the gyms and health clubs.
There was an executive order entered this morning to basically memorialize what the governor said last night about the bars and the restaurants. And as we're sitting here in this meeting, there's going to be an additional executive order entered that will mandate the closing of the health clubs.
And that information will be released in a press release following this press conference today.
The order says that casinos are closed to the general public. Does that allow any leeway for private events or private groups to?
No. When we mean general public, it'd be anybody but a customer.
Any other questions here, or back to the panel?
Closed. I saw signs.
We have today, the Capitol is closed to tourists, and people are just coming in to look. It is open to people having official business at the state offices. So those that would be coming here to do some kind of event with an agency, they would still be permitted to enter access.
All right, let's bring it back to the panel. Thank you, Brian. Appreciate it.
This question is for Steve Roberts. You had mentioned earlier that the Chamber of Commerce will be providing things free to local chambers of commerce. I didn't know what kinds of things would they be asking.
Any of our resources are available to the local chambers. Some of our resources sometimes come at a cost. Legal advice is an example. We're making that available at our cost and not at their cost. Those that pay dues to us will not have to pay dues to us for the remainder of the year. And the whole purpose is to try to have as open a pipeline as possible for the dissemination of information and to lead by example. All of us, we believe, all of us are going to be called on to make some sacrifices either of time or money or talent, and we want to be among the first to step up to make those sacrifices.
Each state has their individual issues and systems of reporting and things like that, but I do want to ask about the numbers situation right now, because it seems when we watch other news conferences, the numbers update a little more regularly. Ours don't seem to be coming in that way, and I just wondered what our process is and why it's happening this way in West Virginia.
We're updating them daily, and we're actually caught up to speed on all of the ones that are running. So the only reason you will have a few pending at this point is because it's much more efficient to use your supplies in a full run. And so, but we are caught up to speed on the things that are coming in.
I'm going to go back to one of my favorite questions. Can you tell me how many test kits we have right now?
It's not a test. There's confusion on. We have again where we were before in terms of sure, but again, that was with one component that was missing. We've asked for more of those. We've got other ones on order. Once that comes in, we can double that. So there's work underway. And plus, I think it's really good that there's commercial testing becoming available.
Any number, though, that you can give us right now as far as what the state has?
I think we're where we were before in that angle, but we are lots more opportunities for ways to expand that.
Do you have any idea when you're going to get those pieces for the testing to be, so you can double your capacity and not have to take from the flu?
That's part of what the conference call was for, that we had to get rescheduled at 11, was to talk about those.
And I just want to go back to the patient zero, the information has become public, and I know that there were some communication issues, and from her post, tracking down where the test was and confusion. This is obviously already stressful enough for people who are sick, scared, etc. What's being done to streamline the process and ensure that somebody doesn't have to go out of their way to track down their test results again?
Well, I think a couple of things. One, we continue to get, I think anytime you do these events, it does take time, just as the governor is talking about getting everybody on board to make sure it's what we need to do work together. It takes time to do those. But at this point, we've again sent out guidance to all the providers around the state, work with the boards and commissions about exactly how to do that, and continue to move forward with that.
Will there be any changing of the guidelines of who is being tested now that more tests are becoming available?
As soon as we have the capacity to do that.
And do you have any kind of, just going to be a wait and see what happens?
We need to find the supply. We need to continue working.
Folks, we have time for a couple more questions.
Are you saying that when you receive the swabs, that will double testing capacity?
Well, that's not the only item that we asked for. But again, we are seeing expanded abilities. Several of our hospitals are using commercial laboratories for testing. There's other hospitals that are doing their own testing in-house. We are working to be able to expand the ones that happen through the Office of Lab Services.
But speaking to the state lab specifically, getting those extra supplies will double your capacity.
Getting the extra supplies that we've asked for would significantly expand our ability to do that, but there are other things on the list that we've asked for that we have to go with that. You have to have all the different pieces.
What about child daycare facilities? We're getting a lot of calls into our newsroom asking about them, and people are concerned because, as we discussed last week, children can have this, not even know it, and spread it, and we still have the daycare facilities open. Why are they not shut down? Why is it all slow? I feel like we're slowly shutting things down. Why not all just at once?
Well, I think the key thing is, the governor said this as well, our goal, and as Dr. Marsh said, is to do that social distancing, to maximize the ability to do that. At the same time, we have to sustain essential community services. And so you're always weighing those risks and benefits of things. Child care centers are smaller groupings of children than schools are, and frankly, you've got to sustain your health care and other workforce. So that we continue to work through that and work with the providers to how to do that. We also know that children are not as affected with this as other adults.
Dr. Sloan, can we expect to see your updated numbers then tonight, like around the same time that around 9 when we generally are hearing about it?
It'll be out this afternoon or this evening, either early this evening, either one.
Yeah, those runs start at different times during the day, depending on how many samples come in. So I don't want you to think it's going to be at the same time every night. We also were running single runs last week, and we got more demand. We started running 2 runs a day, so it will vary. Pardon?
Can you just explain briefly what a run means?
Generally 20. We can do 20, and again, this is at 20 at one time. This is kind of out of my wheelhouse a little bit, but we want to run. We want to use the full composite of a kit, and we want to use all the reagents. So we're trying to do a full run every time, as Dr. Slimp said.
Because we don't have as many tests, you're waiting to do that full run. So if we're not testing as many people, it's going to take longer to get the results.
We're not behind on our testing.
We're not behind.
I'm saying behind, but I'm saying if you only have 4 tests that are
Right, if we
you
might,
run all 20 at once.
right, if we got 24 one afternoon, we might get the 20 done and hold the 4 for the next day so we can add other ones that come into it and do another packet of 20 because that uses the reagents effectively. That way we're not wasting product.
Is consistent guidance.
Last question, guys. Last question.
System automated or by
It
hand?
isn't automated, but there are components that you have to do otherwise.
Are consistent guidelines being sent home with patients who've been tested?
Yes, we have those posted.
We'd like to thank all of you for being here today. Everybody has very busy schedules.
It is an automated system, but there are parts of it you have to do by hand. But it is an automated system.
And we'd like to thank you all for being here again. We're going to try to do this. This situation will keep evolving how we'll hold these, but we're going to try to do it in the best interest of everybody's safety so you can ask your questions still. So thank you for being here. Have a great day, everybody.